This study of CLGB 90206 was a retrospective post hoc analysis of some biomarkers that we had looked at in order to determine any potential prognostic or predictive value to changes over time. In particular, we focused on a biomarker called hepatocyte growth factor, or HGF. Previously, we had shown that HGF had been both predictive and prognostic for response and survival for patients receiving interferon and bevacizumab. In particular, patients with high levels of baseline HGF had a poor prognosis and demonstrated no survival benefit to the combination with bevacizumab. However, patients with low baseline HGF had a better prognosis and demonstrated a survival benefit over interferon alone. So for this study, we looked at the on-treatment effects of HGF, looking at the 4-week value. A couple of key findings were, one, that patients that had low baseline HGF levels for the most part remained low. Only less than 10% actually increased their levels above the median. On the other side, though, for patients that had high HGF levels at baseline, about a third of those patients dropped their HGF levels at 4 weeks. And when we looked, those patients had a better survival than the patients who maintained their HGF levels. When we looked at 4-week HGF levels, high and low, above and below the baseline, there was again a very significant prognostic effect with low HGF levels suggesting a much longer survival. So what does all this mean? Essentially, HGF is the ligand or growth factor to bind to MET. And we believe that MET may be an additional target to VEGF that's important in a subset of high-risk metastatic renal cell carcinoma patients. There's new agents that target both VEGF and MET, and we believe that in patients that have high HGF levels, it's worthy to test whether or not these combination inhibitors are more effective than agents that solely target the VEGF pathway.